Good afternoon and welcome to today's webinar. My name is Amanda from CCIQ and I'm going to be your facilitator for today. Joining me today is Emma Jacobson from WorkCover Queensland and Dominic Manker from the Office of Industrial Relations, and we also have our Manager of HRIR Services here at CCIQ, Jason Wales. Now, when a worker is injured at work, it doesn't always mean that they need time off work, but the recent research has shown that work has important health and wellbeing benefits. So in today's webinar, we will discuss why it is important to return to work as quickly as possible, as well as define suitable duties and how you can support your workers. But before we start, if you have a question, you can ask at any time during the webinar, just using the chat box that appears on the bottom right-hand side of your screen. I'll now hand over to Emma and she'll kick off today's presentation. Thank you.
Thanks, Amanda. It's my pleasure to be here today, and thanks everyone for tuning in. As Amanda mentioned, I'm a customer manager with the small and new business segment of WorkCover Queensland. Many of our customers have never had a claim or only have a claim every few years. As a small business owner or manager, we know that there's lots of things to consider. This webinar aims to provide you with useful real-world info to help you if a workplace injury occurs and answer some of the frequently asked questions from customers just like you regarding what to do to help their employee get their lives back on track after an injury. In today's webinar, we'll provide a quick recap of the main points from our last webinar, highlight some of the research around the health benefits of work, outline what you can do to support recovery, and discuss the importance of an early return to work. So let's get started. Our last session covered the basics, who WorkCover are, what your insurance obligations are, and what to do if someone is injured at work. The key takeaways from that session included that if you are employing, you do need to have insurance, that prevention is better than a cure. Please report your incidents and lodge your claims early. And maintaining a good relationship with your injured workers really is the key. If you would like to review that session, please get in touch with us to request a copy. Our contact number is 1300 362 128. While we spoke last time about what to do if an injury occurs, but we feel it's such a crucial time in the claims process, I thought it would be good to run through the steps as a refresher. And for those of you that didn't attend the last webinar, experiencing an injury can be a difficult and challenging experience for a worker. Being injured limits a worker's ability to perform normal day-to-day tasks and can interfere with their ability to earn an income. Firstly, encourage them to seek medical assistance as soon as possible. Early intervention is essential in ensuring the best possible injury resolution, as you'll learn throughout this presentation today. Next, notify WorkCover within 8 days. Even if the injured employee does not wish to claim, you need to report the injury to WorkCover. Finally, contact your employee as soon as possible after an injury. The genuine intent of this communication is a key predictor of how successful the worker's return to work will be. If it's done poorly, it may create unnecessary challenges and disengage the worker from the process of them returning to work safely. We recommend you show empathy and genuine concern for the worker's well-being, as well as understanding the impact of the injury from their perspective. Ensuring that they're kept up to date and supported can help prevent them from feeling isolated from their workplace and their team. There is extensive research available in relation to the health benefits of work. A research review from the United Kingdom by Professor Gordon Waddell and Professor Kim Burton posed the question, is work good for your health and well-being? And concluded that overall, the beneficial effects of work outweigh the risks. The evidence shows that good work may benefit an individual by ensuring that physical activity is undertaken on work days, providing a sense of community and social inclusion, allowing workers to feel that they're making a contribution to their family and society, giving structures to day and weeks, providing financial security, and decreasing the likelihood that an individual will engage in risky behaviours. It's really important to know that you don't have to wait until your employee is 100% recovered before developing and implementing a return to work program. In fact, recovery at work with duties and hours that suit the condition is often a valuable part of the rehabilitation process. The studies show us that work is an important component of rehabilitation and recovery, as the longer someone is away from work, the less chance they have of ever returning. Work can be a therapeutic intervention, meaning that it's part of the treatment regime, and waiting for a full recovery can often delay your employee's recuperation. We also know that staying away from work can lead to depression, isolation, and poorer health. Employer-supported early return to work helps recovery, prevents deconditioning, and helps provide people with social contact and support mechanisms. Work covers support the position statement from the Australasian College of Occupational and Environmental Medicine and Royal College of Physicians, released in May 2011, which is now called Realising the Health Benefits of Good Work. The research shows that the longer someone remains off work, the less likely it is that they will ever return. If someone's off work for 20 days, the chance of them ever returning to work is 70%. After 45 days, that drops down to 50%, and after 70 days, it reduces further, and the chance that they will ever get back to work is only 35%. So these figures highlight the importance of acting efficiently and effectively to promote an early return to work. Our employers tell us that injured workers gain confidence by attending a safe workplace that helps them improve their self-esteem and mental well-being. Studies show that early return to work reduces the risk of long-term disability and improves quality of life. Injured workers who are offered suitable duties are twice as likely to return to work, and evidence suggests that absence tends to perpetuate itself. That is, the longer that someone is off work, the less likely they become to ever return. We encourage stay at or prompt return to work. This is possible through a suitable or modified duties program or host employment. Workplace rehabilitation, which is also known as occupational rehabilitation, is a step-by-step process that allows workers to regain control and independence in their life after experiencing an injury or an illness. It also ensures the worker's earliest possible return to work. Workplace rehabilitation is initiated or managed by the employer. The employer helps their injured or ill workers return to the workplace and perform work as they get better, taking into account their existing work skills, the effects of their medical conditions, and any other rehabilitation needs that may need to be addressed. This process helps the worker maintain a daily routine, allowing the worker to participate in work activities rather than staying at home. In addition to better outcomes for the worker's overall health and recovery, supporting workers to participate in workplace rehabilitation at the workplace can benefit an employer by reducing disruption, which impacts your productivity. The chance of a worker returning to their normal job is greatly improved when all the stakeholders involved in the injury management process work together. Understanding each person's role and responsibilities is necessary to ensure that the worker receives the highest level of support and assistance possible. It allows stakeholders to connect and work together to solve any barriers preventing the worker from successfully going back to work on a regular and sustainable basis. It's the worker's responsibility to actively participate in rehabilitation as soon as possible once an injury has occurred. The worker should contribute to return to work planning as soon as they are able to. As an employer, it would be your responsibility to provide the worker with rehabilitation and to assist them to return to work as part of their recovery. This process should start as soon as possible after the injury has occurred. Ideally, you shouldn't wait for the compensation claim to be accepted to commence this process. WorkCover will guide you through the return to work process, communicate with all the parties, and pay the costs of the rehabilitation. And the health providers who are involved will provide appropriate, immediate, and ongoing clinical care to a worker to assist them to recover from their injury as soon as practicable. This could include a treating GP or a specialist, and sometimes maybe a physiotherapist or an exercise physiologist. If one of your employees has been injured at work, you can help them recover at work or return to work as soon as possible. A graduated or modified work program, which helps improve work fitness, considers the worker's capacity and their level of function, the medical advice, their individual situation, It aims to develop a range of work skills to improve their work fitness and also provides an opportunity to build confidence in their abilities to re-enter the workforce. Suitable duties don't always need to be in their pre-injury role. We would encourage you to ask yourself what other types of duties are available within your workplace and what projects or tasks have you wanted to do for some time but you just haven't had the time or people to do. Suitable duties are developed in conjunction with all parties, including you as the employer, the worker, related health providers, and work cover. Think about the duties the worker can perform at the workplace within their capacity or matching activities that they are undertaking at home in their usual daily lives. For example, things like grocery shopping or housework or garden work. Focus on what they can do, not what they can't. Work cover can help you identify relevant tasks available in your workplace. But if this is difficult, we can appoint an occupational therapist to consult with both you and your employee to create a plan that works best for you both. Should there really be nothing available within your workplace, work cover can identify host employment opportunities for a short period until the worker can be accommodated within the usual workplace. So this is where work cover arranges to place an injured worker in a short-term host position with an employer who have an established track record of successful return to work outcomes with their own staff. These programs usually run for around 3 to 6 weeks. Work cover continues to pay the workers weekly wages, and the worker benefits from a return to work program that may not be practical in their normal workplace. Work cover have a range of resources to help you build a suitable duties register and identify duties for your injured workers. So our injury information pack includes an information sheet for you as the employer, an information sheet for you to give your injured worker to keep, a suitable duties register and a suitable duties plan, a letter to the medical practitioner, an incident investigation form, as well as a workers' compensation form and a work capacity certificate. All of our material is designed to be really practical, and we suggest that you have it on hand for your workforce. So you can find all of those resources on our website, which is worksafe.queensland.gov.au under the heading Rehab and Claims. The employer has a vital coordinating role in managing workplace issues such as informing managers, supervisors and co-workers of the existence of a rehabilitation and return to work plan. It's really important for a successful rehabilitation and return to work plan that individual roles at the workplace are clearly defined so suitable duties programs are implemented effectively. The supervisor is crucial to a successful rehabilitation and return to work outcome being achieved at the workplace. By offering organisational support to the supervisor, the employer will maximise opportunities to achieve a positive rehabilitation and return to work outcome. A person returning to the workplace following an injury needs to be supported. Having someone within the workplace who understands possible difficulties and who can assist in a smooth transition back into the workplace is crucial. Having a trained supervisor who can confidentially handle concerns raised and keep the rehabilitation process on track is the key to achieving a successful outcome. Make sure you're reviewing and communicating regularly with your employee. This will make sure that they not only feel supported, but it also gives them a chance to highlight any concerns or problems, which gives you the opportunity to resolve them before they impact on recovery. Small and New Business has recently implemented a Triple S Return to Work initiative. The first S stands for Suitable Duties, which we've already covered. The second stands for Supernumerary. This means that work cover can continue to pay the workers weekly benefits as per their entitlements for an initial period of return to work to help them transition back into the workplace. An example of this is when you need to casually hire somebody else to undertake the work that your injured employee usually does. We understand that it's difficult for small businesses to absorb this kind of additional cost, hence we make it easier for you by continuing to pay while the worker upgrades their duties within your workplace. Talk to your customer advisor if you think that this is something that would assist you, but it's important to understand that this is a short-term measure to enable a smooth and efficient return to work. The final S refers to a structured rehab program, often developed with a treating physiotherapist or exercise physiologist This type of program can be useful in developing strength and confidence needed to re-enter the workplace. Plus, it has the added benefit of providing a structured routine and decreasing the likelihood of isolation. In some instances, this can be combined with a host employment program. Employers play an important role in finding solutions to barriers that prevent a worker from successfully returning to work. As employers have a key liaison role with workers, they are in the best position to identify any barriers at the earliest opportunity and commence the process of finding reasonable solutions. Barriers can include social, personal, and environmental factors that negatively impact on a worker's ability to successfully return to work following an injury. The most common barriers within rehabilitation and return to work include the worker or the employer's belief that the worker can only return to work once they have fully recovered from their injury, conflicting views as to whether or not the worker has the capacity to return to work, the worker's fear that they might re-injure themselves if they do return to work, the ongoing presence of any workplace stresses, or the worker's perception that they lack the skills and abilities to do any form of work due to their injury. The most effective way to identify barriers to return to work is to engage in meaningful two-way conversations with your worker. Importantly, find out what motivates them to get back to work. Knowing your worker's motivation may help you support them better in their recovery and in turn assist both you and work covers to overcoming barriers and getting them back to work sooner. If you do have a claim, please encourage your worker to use the Worker Assist app to help them stay connected and supported during their claim. It's designed to be simple to use on any device. It gives real-time information 24/7. It will show your worker any alerts or notifications for important information on their claim. They can have a look at the claim status and the details. Any messages sent out will be targeted to them and their injury. And from an admin side, it's easy for them to do things like update their personal details or assign an authorized contact. For our employers, we have Work Cover Connect, which is our online service that connects you to everything you need to efficiently manage your workers' compensation. So you can manage your insurance, which includes renewing your policy, breaking down your premium details to help you budget for the future. You can use it to manage your claims. You can also analyze your claims and safety data using Work Cover Connect. It has inbuilt claims and safety dashboards with graphs and charts that include some industry comparisons. So I thought we'd have a chat through a couple of case studies so you can see the impact of what an early return to work and a suitable duties plan can have. So our first case study really illustrates the importance of a safe and tailored return to work program. So she was a 24-year-old part-time barista and she worked in a coffee cart in the Brisbane CBD. She sustained a wrist injury while performing her usual work injuries. She attended her GP and subsequently a work cover claim was lodged. The claim was accepted and she required some surgery to repair a ligament in her wrist as well as time off work after to recover from the surgery. When she was ready, she commenced a graduated return to work program and over time progressed back to her full duties. So in this example, the costs of the claim equated to almost $40,000. So while this might seem like a lot, there are many opportunities to minimize the impact of this injury. However, if her employer didn't offer a supportive rehab-focused suitable duties plan, there was the potential for significantly more to have been paid in weekly benefits while she was off work. She could also develop further medical issues by not regularly using her wrist. She may sit at home afraid to use her hand, which could develop into a condition called complex regional pain syndrome, which affects the nerves. This would require significantly more treatment and commonly result in an inability to return to any type of work. So at this point, she would now be looking at a permanent impairment payout to close her claim, which also provides access to common law rights. Workers who are in a similar situation to this barista often tell us that they feel unsupported by their employers and cut off from friends and support networks within the workplace. This can lead to complicating mental health issues that can form part of the claim. So while this example demonstrates the worst case scenario, WorkCover does see this type of outcome with real claims. While the costs wouldn't be directly passed on to you as an employer, they do affect the scheme as a whole, and hence are likely to impact on your premium. On a more positive note, the case study of Ben Roche shows how some workers have recovered, remained motivated, and returned to work after their injury. So when talented award-winning Brisbane bricklayer Ben landed headfirst onto concrete after falling from collapsed scaffolding over 5 metres in March 2017, his life hung in the balance and his future looked bleak. He suffered a severe brain injury, was hospitalised for over 2 weeks, and placed in an induced coma in intensive care for 10 days to reduce the swelling in his brain. Despite the severity of his injury, Ben returned to work through the help of a suitable duties plan. There's a video on our website where Ben shares how he's getting his life back on track by working in close partnership with his employer. He talks about what motivates him to stay so focused on his rehabilitation program and returning to meaningful work. It's a really inspirational story and well worth tuning into. So we've covered a lot of topics today, and there's just a few key takeaways for you. The first of that is that there is extensive research that supports the health benefits of good work. Work forms part of any good rehabilitation program, and it significantly decreases the likelihood of any other issues arising. Regular and genuine communication with your injured workers is vital. And lastly, WorkCover are here to help you. Return to work is our business. It's what we do. So please do give us a call if you need our assistance. I'll now hand over to Dominic from the Office of Industrial Relations.
Thanks very much, Emma, and thank you, Amanda, for inviting me along today for this webinar. As Amanda mentioned, I'm the Acting Manager of the Engagement Services team within the Office of Industrial Relations. And this small team is focused on providing rehabilitation and return to work information, resources and educational material to scheme stakeholders, and that includes employers. So thank you today for listening in. I have over 10 years experience working as a rehabilitation counsellor in injury management and across workers' compensation in both public and private sectors. And I've most enjoyed working directly with employers and enjoy any opportunity to talk to employers about how they might be able to enhance their rehabilitation and return to work practices. And so today, really to complement Emma's presentation around suitable duties and health benefits of good work, I'd just like to highlight some of the key functions of the regulator and also talk to you about some of the tips and kind of takeaways that you can use in practice when working with injured workers, and some of the resources available to you as employers of the Queensland scheme. So the Office of Industrial Relations is obviously responsible for the administration and the regulatory functions of the Queensland Workers' Compensation Scheme. And some of the things included in that pertain to employers, the review process, if a worker or an employer wishes to seek independent review of an insurer's decision, and coordination of matters that progress to the court through the appeals process, and also coordination of the medical assessment tribunals. So importantly, OIR is committed to supporting scheme stakeholders, including employers, with education and information to enhance scheme performance. And we know that the health and wellbeing of workers is central to a productive business for employers. And we also know that managing staff and running a business can be demanding, and workers' compensation can be confusing. So how do we help Queensland employers? Well, there are a range of resources available, and one in particular is the Workers' Compensation Information Advisory Service that is delivered by CCIQ. And one of the services that they do provide through grant funding from the Office of Industrial Relations are webinars like today. And so essentially, this is an independent service that's available to employers. And OIR work regularly with CCIQ to obtain any feedback from employers in regards to the experience that you may be having in relation to workers' compensation matters. And that assists us to inform any policy or review changes that may assist with improving the return to work experience and the general administrative function of the workers' compensation scheme in Queensland. Some of the other elements of that you can seek resources and support from the Office of Industrial Relations specifically include the claims and return to work page of the WorkSafe website. And so in January 2019, we reviewed the whole content of this page of the WorkSafe website, and it's been revised and updated. So if you previously visited that page, I encourage you to check back in there because it's much more clear. There's more of a logical flow to the content. And so we have made a very, very big effort to make that more easy to navigate for both employers to obtain information and resources, and also for workers to obtain information about the claims process. I'll talk a little bit later about some of the content within that page, but certainly it's something that we see as a useful resource for employers to check in with updates in relation to the scheme as well. The other key resource for employers that is a newly formed resource that you should be aware of to promote across your staff is the Workers Psychological Support Service. So this commenced in February 2019, and employers should be aware of it for the purposes of advising their injured workers that they can seek support in addition to the claims process. So whilst they may be receiving support from WorkCover or yourselves in some shape or form, if they appear to have a need that may not be met through the claims process, perhaps it's a psychosocial need, perhaps they need some financial counselling, perhaps you've identified that they're struggling with some of their personal circumstances, whether it be separating from their partner or child and family and child issues, housing and accommodation issues. Workers can access this free confidential service and be supported through a senior social worker providing advice and linking them to community services that may be beneficial to them. So as employers out there in the community, it's important to know about these resources available to you and your staff. Some additional resources to help employers include the guidelines for the standards of rehabilitation. Now, this document's available on our website, and this really highlights some of the key principles and the framework that employers should embed where possible in relation to supporting a worker once they've become injured. So whilst we don't plan for people to be injured, we have safety practices in place to prevent that from happening. Unfortunately, it does happen from time to time. And so if I could point your attention to these guidelines, it's a really good resource if you want to have a read or just cherry pick different parts of it depending on your business needs. But it really sets a platform for best practice management commitment to rehab return to work, early intervention and return to work planning, which we'll talk a little bit more about later as well. The other resource that's available freely through our website is the Rehab and Return to Work Policy and Procedure Template. Now, this is something you can take off the website and insert your business details in order to set some parameters around what you're going to do in the case where one of your staff becomes injured. That'll cover things from first aid provisions all the way through to getting somebody back to work and offering suitable duties and all of that in consultation with WorkCover and the injured worker. And so if you're looking at forming more of a robust approach to your injury management practices and leveraging some of the points that Emma spoke about, then this is a good starting point as well. There's some worker support cards that should be made available to workers and promote early intervention on the part of the injured worker. So raising the awareness across your business about your supportive culture, and there's some brochures that we can provide employers directly if you like. And then obviously there's some pre-recorded webcasts that have happened over the years and webinars that we've recorded. And we're looking at a different approach to webinars across 2019, 2020, which will be a shorter version of a pre-recorded podcast, if it may be, or webcast, just focusing on some of the key points and education messages. And you can access those education points on the website. Furthermore, with our education initiatives across the scheme, we hold 2 annual conferences. So the first half of the year is normally in North Queensland, and so we had our North Queensland conference in Townsville in March this year. If I can ask you all to save the date for the Brisbane conference in October this year, the 16th of October. All of the information is now published and it's all live. You can start to purchase your tickets on the WorkSafe website. There's a specific events page. If you have a look there, you'll see all of the events that are happening in October for Safe Work Month as well. So we know that both injury management and safety go kind of hand in hand, and it's for that reason that we have our conference in Brisbane in October across Safe Work Month. I spoke earlier about the webcasts, but we also have a Rehab and Return to Work newsletter that I would encourage you to subscribe to, where you can receive any broadcast or blasts regarding scheme educational updates. I just wanted to talk to you a little bit more about some of the points that Emma spoke about in relation to suitable duties and return to work, and really reinforcing why we do what we do in this space. And so this slide really demonstrates the benefits of an effective rehab and return to work strategy or implementation of policy, and highlights the benefits to both the employers, yourselves, but not only that, the workers as well. So this is a really good reference point, particularly if you might be having a bit of a hard time negotiating additional resources for your business or getting things across the line in this space when it comes to change in the business. So Emma mentioned some of the benefits of somebody getting back to work sooner rather than later, and the cost benefits are enormous, and we know that it's well documented in the research. But we also need to be mindful of how we treat our workers, and that we need to be providing them with support during their recovery, and offering them a safe place to return to work where possible. We understand that it's not always that easy to identify suitable duties. The next slide just talks to some of the three real tips that you could take away in relation to rehab and return to work practices. And it's important to develop a return to work friendly culture. It's important to make that culture as friendly as possible, because we know that workers are more likely to return back to work in the event that they feel supported. Okay, so, and that will also flow on in relation to any incident reporting that might be happening. If there's a culture of, pushing things under the carpet and things like that, then workers are not really going to perceive their workplace to be accommodating. So it's very important to act to prevent injuries, but also to provide support in the first place when we're dealing with injured workers and their experience in the workplace. The second point is links into that, and it's about providing immediate support following the injury. So with a sincere response to their injury, irrespective of how it was caused, we need to be mindful of offering assistance, administering first aid, and then allowing the person to recover. Some of the strategies that I've seen employers use in the past have even had a system in place where all injured workers receive a Get Well card, and they're assisted with their application for workers' compensation. And I think it's really important to highlight that, we need to avoid blame and avoid any kind of interrogating approach. We don't want to be, whilst you need to be asking questions from an incident review perspective, it's very important to kind of separate yourself from that judging a person's behaviour that may have caused the injury. So there are some really innovative approaches that employers can take when it comes to creating a supportive workplace, but I can't emphasise these 3 tips enough. And the final one would be making sure that you're sincerely supporting actual return to work. And so that means that you're sitting down with the worker, potentially with their medical practitioner, with your claims advisor, and having a conversation about what that looks like. And Emma spoke to that. She spoke to and how an employer can formulate a suitable duties plan, and there are lots of resources and support that WorkCover can provide you. But it really needs to be coming from the employer just as much as it is coming from WorkCover. just in closing, the resources and contact details for the Office of Industrial Relations when it comes to education are listed on the slide. And we'd really encourage you to reach out if you'd like any of the print resources that I mentioned today. There's a Facebook page where we provide regular updates. You'll find any kind of education messages, information on our conferences, etc. on that website. There's a LinkedIn page, and there's obviously the claims and return to work page, which I mentioned earlier. So I'll just hand over to Jason now to talk further. Thank you for listening.
Thanks, Dominic. Good afternoon, everybody. I hope everyone's having a great day, and I want to thank both Dominic and Emma for coming today. Now, Dominic, I'll start with you and just ask some questions, if I may. You've mentioned that you have over 10 years worth of experience in rehabilitation return to work space. So do you have any other learnings for small to medium businesses who are listening in today regarding rehabilitation return to work? So what are the key things that you found in your experience that SMEs need to be aware of?
Yeah, look, I think it really comes back to that management commitment. While there are limitations in what might be able to be offered to a worker, especially if it's a small business when they're injured, the approach and the communication that is between an employer or a manager and the injured worker is absolutely key. Now, we all know that communication enhances collaboration. And if you're not collaborating with the worker, then they will feel left out. They won't feel part of the journey, and they will feel like you're directing them to do things. So one of my biggest tips, and I've observed it in workplaces where a return to work might deteriorate at, say, 3 to 6 months, it's probably linked back to poor communication on the employer's part. Not always, but if an employer can enhance their communication with the worker, then that's going to help. I think that's a big takeaway for me.
Oh, okay, thanks, Dom. And you've mentioned a lot of resources available to businesses on your webpage. Now, one thing that I've noticed about the webpage is it can be quite difficult to navigate. So is there any pointers to navigating your webpage and getting those resources? Because some people just might give up if they can't find what they're looking for. Are there any key search words or anything that might be of assistance to businesses?
Yeah, well, as I mentioned earlier, we hope that it's more clear than it has been in the past since the early 2019 update, which is we have received some feedback that it is a bit more, the order is much easier to follow. However, I would use it as a Google search type approach. And certainly if you know what you're looking for in respect to keywords, then you can use the search function at the top right-hand corner. So this is a shared website between Office of Industrial Relations, Workplace Health and Safety Queensland, and WorkCover. And so that's one of the reasons why it's a little bit hard to navigate. But the search function in the top right-hand corner, if it's in relation to rehab and return to work, those exact words will yield a pretty productive search outcome. Yeah.
Yeah, well, thanks, Tom. And you've mentioned that CCIQ is a recipient of a grant by the Office of Industrial Relations, and we provide free workers' compensation advice through the advisory service for every employer in Queensland. And if anyone wants to contact us, they can contact us on 1300 365 855. Now, I just want to ask Emma a couple of questions, if I may. And Emma, lovely to have you here today. One thing that stuck out about your presentation was supernumerary.
Yes.
Yes, I think that is something that we need to explore a little bit more because it might have some great benefits for employers out there. What actually is it?
So essentially, what we will do is we will, through a suitable duties plan, get your injured employer back into your workplace, working for you, doing suitable duties, whatever they may be, and we will continue to pay the wages for that person while they're doing those suitable duties. Essentially, what that allows you to do is hire somebody casually to do their usual role. And for a small business, the financial impact of it, somebody being off injured, can be huge. So we're just trying to reduce the impacts on the business. So it is only a short-term arrangement,
Right.
but we find that it is something that really, really helps people get back into their work. If we take that financial worry away from the small business owner, from the small business employer, they're generally able to find something because essentially they've got somebody doing work for free. that helps them out, whether it's that person's individual role or something completely different.
Okay, that is a wonderful initiative, I think. And of course, people can go onto the webpage and find out more information or even speak to their case manager if a claim does occur. Yep.
Absolutely. So we would encourage you to speak with the customer advisor who's looking after the claim. In regards to supernumerary, there's a few things we need to do and make sure we have lined up with a suitable duties plan to make sure it's the right approach.
Could I just say that that's really important, because we know that it will engage all of the parties in that respect as well. So one of the learnings across the Queensland scheme is that we could probably do a little bit better in relation to return to work plans. And that's something that I suppose WorkCover can assist you with. But in order to ensure that the worker is aware of what's going on, if everything is documented in a return to work plan and they sign it, they feel part of the conversation, they feel part of the plan, they feel part of the journey, and they're going to be more interested in the outcome. So one of the things that we could probably improve on across Queensland would be return to work plans and actually getting those documented.
Yeah, I'm glad you sort of mentioned that, Dominic, because majority of the calls we get to the advisory service is, I don't know what a suitable duties plan is. What do I do? How do I do this? I don't really know what to do. And by having these resources out there, it sort of provides, employers with the next step and understanding what their obligations are. Some employers are a little bit fearful about their obligations when it comes to suitable duties, and will they get penalised if they can't provide a suitable duties plan or facilitate rehabilitation return to work? Is that a possibility, or can employers get in trouble by either WorkCover or the Office of Industrial Relations when it comes to rehabilitation return to work? It can be quite complicated and scary. So is there a penalty, or can people get in trouble? Employers get in trouble if they don't do it?
Well, certainly there are legislative provisions in Section 42 and Section 228 of the Act outline the requirements for employers to, where reasonably impracticable, provide suitable duties to their injured workers. Now, and that's in recognition of there's a whole heap of subsections of this section of the Act. So it's certainly legislated, and we certainly encourage employers where reasonably impracticable. If it was reasonable and practicable for them to offer somebody suitable duties and they chose not to, then obviously then there's a risk that they're not meeting the legislative requirements. So it's in the Act for a reason.
Yeah. Emma, what have you got to say about that sort of thing?
Absolutely. Like I mentioned at the very beginning of the webinar, a lot of our customers have never had a claim before, or they only have a claim once every few years. So we are very supportive in helping you. So what we can do, if you're coming up blank, you're trying to put a suitable duties plan together and you're just thinking, I've got nothing that I can offer this person, we can engage with a return to work service or an occupational therapist. And what they'll do is they'll come out and they'll meet with you, they'll meet with your worker, they'll have a look around the workplace and they'll see if they can help you identify anything.
Is that an extra cost to a business?
Absolutely
okay,
not.
I wanted to clarify that. It's not an extra cost at all.
No. So it's done as part of the claim, and it's done from the point of view of, let's help this person get back to work, and also let's help this employer identify some suitable duties and start building their suitable duties register. So if things do happen down the track, they've got some tools and some resources they can go back to. Absolutely no cost to that.
Okay, great. We have a question from Kevin. What if my employee doesn't turn up for their return to work program? What happens? I'll start with Emma.
So it is our expectation, and it is the worker's responsibility to be engaging in, actively participating in their rehabilitation. So first of all, we would want to understand why they haven't shown up. If they don't have a reasonable excuse, we can, go down the path of suspending benefits or even ceasing the claim. But that's not where we want to start. We want to approach it from a supportive way, understand what's caused them to drop out or disengage, and try and encourage them to get back on track quickly and, positively.
Yeah, I'd have to echo that approach. But I suppose it's important in those circumstances to identify why this person isn't complying. So if you take a step back and assess the situation, well, are they always this way? Are they avoidant of kind of engaging and getting back to work, or has something happened for them not to turn up. And some of the ways to understand what the reasons are is to actually coordinate a case conference with all parties. So WorkCover can talk to this and should be doing this regularly with difficult claimants or workers.
Yeah. So Dom, I guess it gets back to the basic, communication scenario, isn't it? If you're not communicating with your workers, there could be a possibility where they're not going to turn up, and if you're not communicating, it could happen. So,
I think it's fair to say that WorkCover probably wouldn't go to the extreme of suspending someone's benefits unless there's some kind of a pattern of evidence that and as an employer, you need to be obtaining that information and understanding. Have you asked the person, have you documented their expectation in a suitable duties plan to turn up at 8 o'clock on Monday? Well, was it just a phone call? Well, maybe that's not enough for this worker. Maybe we need to be a little bit more clear and transparent about the expectations.
Yeah, we get the calls of, this person's not turning up. Can I fire them immediately? So we advise, but there's an understanding that it's a collaborative approach to rehabilitation and return to work. So no, people, you cannot fire them if they're not turning up for their rehab obligation. I've got one more question, which I'll pass over to Dominic. What happens if someone injures themselves while undertaking a return to work program?
Oh, geez. Well, that's most unfortunate, and I hope that doesn't happen. But what does happen is that, it would depend on the nature of the injury. It could be an aggravation of the existing injury, and I'll kind of put this over to Emma as well. Depending on if it's a new injury, then it's potentially a new claim.
Yeah, right.
Yeah, it could be a secondary component to that would be up to the determination of WorkCover, really. Emma, did you want to talk to that and your experience?
Absolutely. So it does happen. Luckily, it happens quite rarely. But if somebody does re-injure themselves while they're on a placement, we basically get details and we look at it sometimes as a new claim, sometimes as an aggravation of the existing injury. So it's really important to let us know if it does happen so we can walk through exactly which situation it is. We can get the appropriate medical reports or evidence and talk to you and the worker about what's happened and let you know if it's something where compensation would apply.
So it's good. I want to mention that no claim is exactly the same as the claim before. It's relating to the same injury. So just be mindful of that. We do have a question from Gianna. I hope I got your name right, Gianna. And her question is, what happens if you think your work environment may be making someone sick in the workplace? For example, like an asthma sufferer, and they're working on a recycling plant. What steps can the employer do around that if their environment is making someone sick?
Well, that's kind of linked back into your safety requirements as an employer and your work health and safety obligations and responsibilities. So if somebody is sick and they consider that it may be due to the work environment, then they're entitled to make a claim for compensation. If you're, as an employer, trying to be proactive in this space and you're concerned about safe levels of exposure to the elements, then based on what you know about your worker, then you should be making every effort to maybe assess the air quality and do some of those testings to understand if there are any risks. But I would really, and not being an expert in work health and safety obligations and requirements, but potentially have to look at some of the obligations for employers in that respect.
Yeah, I would emphasise the implementation of a safety management plan that identifies all the hazards in the workplace and having some safe operating procedures and looking at codes of practice to combat or mitigate the risk of an injured employee.
Yeah.
Okay, we might just finish off there at the moment. So everybody have a great afternoon. I'm going to hand you back over to Amanda. Amanda will just mention some closing points, but once again, thanks to Emma and Dominic. So
thank you.
Thank you. Great, thank you, Jason. Thank you to Emma and Dominic for attending today and presenting. We also want to make sure that you register for our next WorkCover webinar on mental health, which is on the 9th of July. And we also have some other HR IR webinars coming up. This week on Thursday, we've got employee contracts and what to include. That's on Thursday. And then we also have one around the modern award changes on July 3. I also wanted to mention, for those that are in the Mackay region online today, that we are holding an injury prevention lunch with WorkCover and the Office of Industrial Relations on the 24th of July at Harrop Park. And it's going to have a lot of local businesses there sharing their stories behind their own return to work cases. So what we'll do is we'll send out an email later today with a link to the recording and the presentation slides, and also to links to these webinars and events to register. So thank you for everyone who's joined us, and on behalf of CCIQ, we hope you enjoy the rest of your day. Thank you.